And good evening. An urgent concern tonight. Despite 8 million COVID-19 vaccines administered in Wisconsin, our hospitals remain at a breaking point. Our Mary Jo Ola live outside Advocate Aurora Hospital to explain why. Mary Jo.
Carol, as of Sunday, Advocate Aurora Health alone reports 349 COVID-19 hospitalizations in Wisconsin and more than 400 over in Illinois. That number has jumped up from a week ago as well as last month. Leaders with this health system say the data shows how critical the vaccinations and the boosters are at this time. Hospitals face climbing COVID-19 cases.
Numerous times every week I have a patient with severe illness on the ventilator or is about to die.
Advocate Aurora Health leaders released what they found in a sampling of 430 patients hospitalized with the virus in Wisconsin and Illinois to illustrate how vaccines make a difference and dispel misinformation.
Releasing these numbers is really just to give a picture of what is happening in our communities.
They found 74% of patients never received a vaccine shot, 18% are partially vaccinated or due for a booster, and 8% are fully vaccinated and boosted. Out of that smallest group, Aurora says a third are immunocompromised, and the rest?
Most of our people are older or have some other risk factors for severe disease, though they're not technically immunocompromised, like have cancer or chemotherapy or something like that.
The doctors join a chorus of medical and health professionals encouraging COVID shots. Recently, public health officials reported 12 COVID cases were tied to a Milwaukee County wedding. And Wisconsin's first confirmed Omicron case was a Milwaukee County man who was traveling abroad. Health officials say all of these individuals were vaccinated. Some had their boosters and all were mild cases.
Yes. Can you get COVID if you've been vaccinated and boosted? Yes. But your chances of getting severely ill or dying from it are extremely low.
Dr. Mendoza stresses that getting COVID does not create the same level of immunity as the vaccines.
That immunity fades rather quickly, and the antibodies kind of not disappear, but they become weak. And as the mutants just come in, then the chances for a reinfection are quite high.
Now, Dr. Mendoza, who works in Green Bay, says 9 out of 10 patients in their ICU, as well as all of the ones who are on ventilators, all those patients are unvaccinated. It's a trend that he says has not changed since vaccines became available earlier this year. In Milwaukee, Mary Jo Ola, TMJ4 News.
Yeah, very important to note. Mary Jo, thank you very much. We have new information on the rapidly spreading Omicron variant. The World Health Organization says vaccines are not as effective against Omicron, but early data finds the new variant does not cause serious symptoms. Now, Omicron will become the dominant variant in London in the next 48 hours. This according to Britain's health secretary. Omicron represents over 20% of the cases in England. In London, it has risen to 44%. An Associated Press poll finds Americans are more concerned about COVID because of Omicron. About 36% of Americans now say they are very or extremely worried that a member of their family will be infected. That is up from 25% in late October. 57% of Americans now say they always wear masks when they're outside of their homes in crowds. But that's well below the 82% who said back in February they were wearing masks. But note, that was before many people were vaccinated.